Hello, good afternoon to everybody. Here we are in the second edition of the workshop on apps, development of health apps and e-health services for people with rheumatic and musculoskeletal diseases. And just some summary from what you wrote before coming to the meeting. Apparently, most of you said that you don't use or have ever used or rarely use apps or e-health services, or you think you don't use them. And, but at the end, the majority of delegates here believe that patients should be involved in the development of these tools for clinical practice. So this is what we'll talk today. Just as an outline, I'll tell you that I will present just 15 minutes to remind you what eHealth means. Then Susanne Pettersson will present a case study from the Karolinska. And then you will work. So you took your tea, your coffee and everything because you will have to work. And then feedback to the rest of the groups. So to start, some definitions about eHealth and health services. Do we have any people from the computers or the informatic field here in the... No, we don't have anybody? This is odd. Somebody should be computer or IT, no, nobody? Well, you tell your children or your granddaughters, whoever, there's a lot of work in this field. Lots and lots and lots of opportunities. Not only the consumer informatics, which is what we will talk today, but also in the medical and clinical informatics and bioinformatics. So what's eHealth? eHealth comprises a lot of different things, from electronic health records to big data. I'm sure you all have your records in electronically already there, so you have been in contact with your health services already, right? And this is very useful to communicate between specialists and GPs and so forth. Sometimes they're not that good, but this is what we use. Also, I'm sure that you have your prescriptions going through an electronic system, so you are using also some sort of e-health in your daily life. Does any of you have ever used telemedicine, like consulting to a specialist that is very far from your place? Well, not many more experiences. That's also eHealth. And we will talk today about consumer health informatics, which is more about apps, but also to wearables. Have any of you have a wearable? You know what a wearable is? These things you put in your body to track your, no? Well, those are consumer health informatics. Then the doctors, I'm a doctor myself, I'm a patient, lots of things. We use Medscape and PubMed and many other sources of information that are there in the internet. So this is also eHealth. Teams that cannot be in the same place. Let's imagine we have an adult rheumatologist and a pediatrician in very different places, so they have to communicate somehow. So they use virtual healthcare teams. The apps, this is mobile health, okay, or eHealth or mHealth. And they can either be in smartphones or you can have them also in the web. We will see that. But also, all this data that we are putting out there can be used to do research. This is what they call big data. And it's very important for people who does research. I do research, it's very important for me also. And finally, all the information systems that are needed to get the appointments and to have the hospitals running. So you have been, all of you have been exposed to eHealth to somehow. Okay, but the thing is today we will concentrate not in all the other things, but on apps and eHealth services. What's an app? App comes from application, which is the same as saying software. The only thing is that it's usually used in a smart device, sort of an iPad or a smartphone, iPhone, whatever. And it's usually very small, so they have a very specific use, like one function or they are very easy to develop. And you can have apps online in the web. You can have also apps developed for the iPhone, for instance. Some apps are developed for the iPhone and for Android systems. Some others are only for iPhone, whatever. Okay? So you know what an app is. It's a small software for mobile devices. And what do we use them for? There are many uses, like reminders, when to take your pills, when to go to the doctor, or to monitor how is my pain, how many swollen joints I have, or did I take all my medications, did I do my exercises. Other apps are used to facilitate communication. I'll give you an example in a minute. Others are, like this one, are used to learn by playing, like where is my liver, where is my spleen, how does it work, things like that. And also, you can use apps to avoid unnecessary visits, like you consult there whether you need to contact a doctor or not. Okay? But what are the advantages and the high and the lows of apps? They are very fast. You can, in a minute, they tell you there is this nice app, you download it in your smartphone, you can use it. Very fast. They are cheap, most of them are for free, or 2 euros, 10 euros. They are efficient in whatever they are looking for. If they want to measure something, they efficiently measure. It depends on what you need from them. They are accessible. Anybody can download them from Google Play or from Apple. And most of them are anonymous. Not all of them. Some apps you have to enter your name or where you work or who's your doctor, but most of them you don't have to say anything, you just download them. Then the challenges are this here. First is credibility. Anybody can create an app, yes, but not all the apps created are credible. Like, I don't know, somebody who wants you to use certain medicine can create an app for you to go and take the medicine. Then in some apps, there are issues of confidentiality because you have to write your name and you have to give more sensitive information. Okay? And finally, which I think is the most important one, is to engage you. So I download an app, I use it once, and then I don't need it anymore. So what was that app for? I mean, to get the information, I can just go to a web and take the information. I don't need an app. So, and also, if the app is disturbing you, like is sending you reminders all the time, or sending you emails, or popping up, or notifications, telling you all the time you have to input data, then it's kind of disrupting, and you just delete that app from your smartphone. Yeah? So they have to be user-friendly. This is what they say. Let me give you just a couple of apps. You have also a list there in your tables and in the round tables. You will see some other apps. There are thousands of apps. This is one developed by the Arthritis Foundation. It tells you, you set a goal, how many miles I should walk in the day, and they track your walking. And this is one from Spain. I like this one very much. I have it in my smartphone. It's an app to help you asking questions to the doctor. Like, for instance, if the doctor just prescribes you a medication, it tells you to ask the doctor, does this interact with the other medicines? How do I refill? How often do I have to do things? So there are apps for many, many things. And in fact, the Arthritis Foundation, in the webpage, they have a selection of apps that are useful for the patients in their membership. Okay? But talking about apps, here we have Susanne Pettersson. She's been a nurse for 25 years involved in the development of apps, and she's going to tell us something about apps and eHealth services in Karolinska Institute.
Thank you very much for giving me the opportunity to be here today. I've not been involved in apps for 25 years. I've been in the field of rheumatology for 25 years. And just the last year, I've been involved in several projects concerning eHealth. So, and I'm going to give you some example from what kind of eHealth services that we are using connected to where I'm working. I'm working at the Karolinska University Hospital in Stockholm. So I'm going to tell you a little bit about what we call an online screening service, something that we have as called patient's own registration that's connected to our quality registry and can be used as a medical decision support. A rather new pilot project that we call patient's own blood testing or blood referral. And also one that's also in the phase of the pilot is to promote physical activity. Why am I showing you this many opportunities? And it's because I think there are different phases in the disease and different needs. So that's why I'm going to present the different ones.
So what kind of needs you, or unmet needs?
Thank you for asking. There are several needs when we are talking with the patients. We find out that there are phases when you need some kind of support for decisions. And the one that's going to present for you is more like the pre-phase, the phase before you meet the clinician. But there's also phases when you have got your disease that you want to be in charge and monitor your own disease, just follow the project or your own disease, and also to use the result and facilitate to share decision when you meet your physician. And of course, most of the time you're not at the hospital, you're not in contact with the healthcare. And are there any support or needs to promote health?
Okay, so can you tell us some about them?
Yes. This is a picture that's going to illustrate a work we had where we interviewed, or my colleagues interviewed patients on the way from the first symptom until they reached the rheumatology unit. And you can see all the red back arrows is actually where there could be a critical point of delay. And in this first project that I've been going to present to you is what I call the pre-care phase. It's the phase where you seek a lot of information. You ask your colleagues, your friends, and you go out on the internet. And we call it an online screening service. And I'm sorry this picture is in Swedish because we haven't translated the whole service yet. And it's called ont i lederna, which in Swedish, or if you translate that, is meaning that you have pain in your joints. And we chose the name because it's one of those words that's actually put into the computer. You can see what words people are used when they're seeking information on the internet. So if you're going to develop a product, you want the citizens to find it. So that's why they have used the name ont i lederna. And this is a service that is actually built up to use on cell phones or smartphones or tablets, but can you also use it on the computer, depending a little bit on the web browser. So that's a technical issue there. And you are quite many, so I can't let you all try to fill in the questions. But there's a set of questions, or like a test, or whatever you want to say. It's about questions about your signs and symptoms. For example, swollen joints, pain and stiffness. And depending on what you're answering on the first question, there'll be the following questions. You can mark where on your body you have your problems, the intensity, the duration, and impact of daily living. And in the end, you get a summary. Either you look at the computer at a rather extensive summary when you can read why we asked all the questions. For example, why are there a question about psoriasis? And then you can read something about it. And this is just a printed version that you can hand out, you can print out. You can bring it with you to the physicians, and we have used it in a pilot at some primary healthcare centers where the patients actually took this paper to the general practitioner. We also used it at a where they tried to stay last year when we saw 100 patients in 3 hours and only having 3 doctors. They answered all the questions and brought this paper to the physicians and got a really short, brief, concentrated consultation. And it's actually helped us to find some new patients, or help the patients to get a really short way to the rheumatologist. This is a decision support. this is supporting the patient to advise them if they should seek the healthcare system or not. Could also be used at a general practitioner who wants to have advice on how to write a referral, because there are questions that we want to have if they're writing a referral to us. And the patient participation have been very important in all the steps, both in identifying where this app or eHealth service could be useful. We also tested during the pilot the questions. Were the questions suitable for the patient, easy to understand? Could they actually use the tablet and ask to answer all the questions? And of course also in the evaluation.
So this is an app? This is an app mainly for pre-disease, so people who think that they may have the disease and they fill it up and then they go to the doctor.
Yeah, that's true. That's mainly for what we call non-patient or possible patients or potentially patients. So to help them. And some of the patients that we have interviewed had actually said that this felt like a preparation for the medical visit, because they know what kind of questions the doctor will ask them. And in that way, they were talking about the same thing.
So I imagine the problem would be to disseminate this app to who is there, because they still don't know what they have.
Yeah, that's true. The dissemination of this, to spread it to a lot of people, is one thing. But actually, nowadays it's on the national. We have kind of a national information site where you can go for advice, for healthcare advice, and it's actually connected to that now. And also if you call for, we have a number where you can call for medical advice, then they can actually advise you to fill in these questions and get some support.
Okay, so this is the first app?
Yes, this is the first app.
What else do you have?
Then, when you actually are a patient at our clinic, we have quite a long time now used the quality register that we have, and also used its important with patient-reported outcome measures. And the patients had the possibility to enter their assessment of their swollen and tender joints, fatigue, and etc., either at home or at the clinic. So it's optional, and we call it the patient's own registration. And if it's properly used, it could actually be used as a shared decision at the clinic, because the patient's assessment and the physician's assessment could be discussed in the medical consultation. And the patients have access to their own data, so they can go back and see the course of their disease. How many swollen joints did I have last year? And to be able to, and this is a long-going project, and be actually in this very early of this, they actually employed one of the patients as a care designer to design the way we could use this. And also an ongoing project to evaluate what kind of patient-reported outcome measures are important to have in the quality register.
So that's very interesting. So patients are involved in all the...
I think today it's one of the most important things to have patient involvement when we are developing eHealth services for patients.
Well, instead of patients, it's the users of the app, actually.
It's not only the users, it's only development process as well. And to have the possibility to have access to your data, we have to think about eHealth and eHealth security and safety. So we have the possibility the patient can log into what we call My eHealth Care Contact with an electronic identification. And depending on your medical center, what they decide, which issues that the patient can have access to, this quality register and your own registration is one thing. And the new thing that we actually just piloting and got a prize for yesterday is what we call patients' own blood testing. That is a partnership that we can actually give the patient the possibility to write their own referral for blood testing. And at the same time as the results coming to the patient, to the physicians, the results is coming to the patient.
So it's sort of an appointment to get the blood test and then the results, or?
They write, they do the referral in their cell phone or at a computer at home, and then they go to the laboratory as usual, instead of calling me as a nurse and ask me to write a referral for the blood testing. So it is some of the patients that regularly normally have to go and do their blood testing every 3 months, and they don't have to contact me to have the permission to do this.
So it's saving unnecessary consultations.
We think it's saving the time to have some of them feel that they have to make into really getting into contact with the nurses or whatever, so to doing the referral.
And for this app or solution, you also involve persons with rheumatic diseases?
Absolutely. We involve patient participation in every steps, and we have, or every step, but most of the steps. The patients on blood testing, we were piloting last year, and now we have a second pilot. And we have employed one of the patients from the first pilot who has really a lot of experience on how to use it in the development team, together with the technicians and health professionals, etc. And lastly, I'm going to give you some information about a very interesting project that just now recently finished the pilot phase, and is the summary of the evaluation is in writing phase. There's been several scientific papers published on the process of developing an internet service using participatory design. This app is actually promoting physical activity in RA patients, and they have involved patients in all steps. From the first beginning with focus groups, and where the patients and technicians and so on discuss what kind of service do we want, what kind of service do we need, and looked at all the proposal, preferences and agreements. And two very important things came up. They wanted to have this app as a self-monitoring thing, but also peer support groups, with only peer with rheumatoid arthritis. So the ones that are in this community or the internet community, they know that have the same diagnosis. And it's been piloting in the test period during the winter, and now, of course, we are waiting for the interesting written summary of this.
So this is a mixture of an app and a social network? Or?
Yeah, it's an app, but you can give PEPs, as you do on Facebook, for example. You can PEPs to someone, and you give feedback because you can see the others' results. But this is not. You can just not enter this group. There are some people, and you know who those people are. So now there's a lot of discussion. Where is this most suitable? Maybe, for example, if you have had a group met at a gym or together with a physiotherapist, and then in a phase where you not really need the physiotherapist any longer, but you need some kind of support and some kind of peer to encourage you to continue your physical activity.
So you call your friends and...
Yeah, but it's your RA friends.
Yeah, your RA friends.
Yeah.
Okay, so we've seen several apps, but I imagine you had lots of challenges.
Oh, sorry. Yeah, of course, as always, we want everything to be finished yesterday. So time is one important. It's always taking longer time than you think to develop eHealth services and apps. And there's also this collaboration, because if there are several different professionals, patients, technicians, even if we have the same language to speak in Swedish, we don't speak the same language because we have different wordings of things. We have different visions. And if you put words together and we agreed on this is our vision, it could be sometimes that we actually mean different things. So that's actually a challenge to really work together at the same goals. Of course, as I've talked about a little bit, there's a rules and regulation in e-safety that you always have to take in concern while working on eHealth services and when you're building up apps and so on. And then is the implementation. We build up this nice thing, a possible communication tool, but how do we spread it, and will anyone use it? It's, as I said, money and time. This two is very connected. But it's also one very important thing that you have to discuss early in the development of eHealth services. who is going to take care of the administration, who is going to take care of the management, could have to be adapted to different devices.
Yeah, and who is the owner and who is behind all these apps?
Yeah, to summarize a little bit, it's mainly the top two of here, the Karolinska Institute, which is the university, and the Stockholm City Council. But of course we have, and I'm working at the Karolinska University Hospital, we are not the owner, we are just more the user of these health apps. But the quality register to the right, they are the owner of the quality register. But then sometimes we pay for help for, like, for example, the technical advice and so on, and they are not the owner of it. And of course we have had a lot of foundation and money from, for example, patient organization and so they are all important collaborators.
Okay, so thank you very much. You press the next slide, because now is everybody's turn to work. We are going to be divided in 3 groups, around 10 people each. They will be in each one of the tables. This table will be stream live, so you go there if you want to be there, stream live. Otherwise, you go to the others. And there in the different tables, we will discuss mainly challenges and solutions for the development of either apps or health services, depending on the table you are in. Okay, so for that, we have half an hour of discussions in small tables, and then we will reconvene for the feedback of all the sessions. Okay? You go to the table you want. There's only the place that you see there, so it's first come, first served.
And you who had a red dot on your name and absolutely not want to be on the stream, you're supposed to be on the table in the back.
Tell me if I do. No, I won't tweet it directly.
Okay, so maybe you don't want to talk, you just want to tweet. So have you seen these? Here's some examples if you want to. You don't have to look at them, but if you want to. It's more like, absolutely. It's more like you can look at them if you want to have examples and IDs. Otherwise, it's mainly a free discussion, but the focus will be, okay, we need more rooms.
Yeah.
Okay.
I know this is the most crowded workshop. Probably could be more than signed for it.
Cheer after crowded, it's alright.
No.
But you can sit here, I can stand up otherwise.
Devil loves that, you know. Shouldn't say.
She said it enough. What the sheet is
Really up to speed with things, John.
So any initial comments and ideas? It's more like what you can just lose your mind and think, say whatever concerning eHealth and apps, but it's mainly what you think your organizations, are they responsible for anything, or should they consider anything? What are your recommendations for your organization to work with concerning this?
To work with
eHealth Yeah.
With work with health apps, is it?
Yeah.
eHealth. Yes.
Or eHealth.
Yeah.
Well, I suppose are we working on it? The self-management courses going out.
Do you consider education courses online with that?
Yeah.
It wasn't in one of the. It wasn't in the.
No. I gave just examples
Yeah.
because we also know that everyone hasn't experiences of e-health services, so we have to give examples. And you don't have to think about things that actually exist, but you can also loosen up your mind a little bit.
The ones that you presented, were they initiated from the patient organizations or from the research community or the health community, or?
I think it's mainly an idea from the research community in one way, who invited patient organization to share what their needs. So it was not actually the patient organization saying we want this, but the healthcare professionals invited the patient organization to ask them what kind of ideas they have ideas of that they want to do something.
Maybe a research initiative via the apps would be useful. We recently had a research done to 300 of our members, and we had to call them each. If we had some closed environment app, we could do what's popular for questions right now and just stream those to their apps directly. And I mean, aside for helping an app which would help them, could be also an input device to us as a server.
Yeah,
You know, like that.
absolutely. Do you think the patient organization should work with that kind of app?
Yes.
Yeah.
Granya's too quiet. She won't speak about it.
No, I
is
think.
it?
I mean, I work in Arthritis Ireland, so I work in our services. So my role is developing the services that we have for patients, and we get approached all the time by companies and people who are interested in developing health apps for us. And I'm by no means an expert. Yes, I use health apps. I have a ton of them. Say, for instance, downloaded onto my iPhone. Most of them I don't use. I could use maybe 5 on a regular basis. Well, sorry, when it comes to health apps, maybe 2 that I've used. So it's kind of, as an organisation, you know, you have a limited amount of money, you know, and you fight very hard to raise that money every year. So you want to put it into services that are really going to make a difference. I mean, the attractiveness of a health app is that when you look at the community of people with arthritis, one of the difficulties we would have as an organisation is reaching out to younger people and how to engage with them. And we just recently held a focus group where we invited people under the age of 50. We asked them, how can we better engage with you? And one of the biggest things, you know, and it wasn't a eureka moment or anything, but people were saying, well, you know, we have so much going on. We're trying to keep our career going. We're living with a chronic condition. We have families. We have young families. We have all those pressures that everybody else has that isn't living with a chronic condition. So it actually puts more pressure on people to interact physically with an organisation, you know, go to an event, go to a conference. So the whole kind of, you know, internet or e-space is an area that we want to develop. But whether we put our resources into a health app, you know, our concern always is, well, by the time we develop this and the funding that we'll need and the money we'll need to, you know, to put it into, it'll be out of date.
Yeah.
You know, now I don't know that because I'm not an expert in the area, but the fear is that we put all the money into doing something like that and then it is out of date. And that's I mean, I think if you read stuff on apps in general, that is one of the concerns, you know.
I had a chance to visit San Diego conference last year in US. There was companies there that developed apps but came to the Congress to hire people from patients and doctors actually to help them develop the apps. So in a way you could say we've been approached as well. We'll help you develop the app and you're going to do it for us for free, but we are going to give you our knowledge as a professional standpoint of view, and you can include it in the app, and then we use the app service you provided, something like that. And make a donation through the apps, like people who use it. It's very good for fundraising, and this is what we would be looking to do next. Do a fundraising through the apps. It couldn't be much more simpler. Now the most popular thing in the apps is paying within the apps. The apps is free, but you pay for a certain service within an app, and then you could make donations there, which would be very, very useful. Something like that.
I like the idea of patient organisations driving the need for a particular app, because there's 500,000 health apps out there, and you really don't know the credibility of most of them, if not all of them. And I think if patient organisations can drive the development and implementation of a health app, then it comes with a lot of credibility, and it also speaks to the engagement. I think people will be more engaged if they know that the app comes from Arthritis Canada or Arthritis Ireland, etc. I think they'd be more engaged with it if they know the association. For this organisation, I represent ASIF, the Ankylosing Spondylitis International Federation. A screening tool of some description would be the best thing, because the major thing with AS is the length of time from onset to diagnosis, typically more than 8 years. So some sort of screening tool that would be promoted by ASIF, say, as an app, but available to anybody with lower back pain would be extremely useful.
The one area I would always feel, particularly in Ireland, where our waiting lists for appointments are so long, is that if you could have something where you could actually have an online application where you could go online and say that there was a rheumatologist available, or a bank of them, where you would and get an emergency, and then they say, well, we really would need to see you. So that at least you would get an appointment from your doctor saying, right, this is I've set up an appointment for you online. Take this time, and if you don't take it, you lose it. And then on from an initial discussion, that then you could decide if you need it. Because there is a time when you just need to see your GP for quite a while before your disease progresses. You don't necessarily need to be going privately to see somebody. So, and I know I know that in the States you can do that, but certainly it's not available here. And that's something that, through ourselves, Arthritis Ireland, and the HSE, which is our health service here, I'd imagine it'd be cheaper to do it that way, but I wouldn't imagine it would be expensive either, because the software would be there.
It's often the development and then the maintenance of it, so it's not going to be out of date, as you said before. So when you develop something, and then all the other technological system is changing as well. So they have to be able to communicate. So that's why it's nothing you just do once. If it's going to communicate with with another system.
It's almost like a Skype, isn't it, really? Really, it's just like a Skype application you're using.
I think there's another problem as well, that the healthcare professionals are very slow to share the information that they get.
Right.
They're all for gathering information,
Okay.
but they won't share it. Because we're looking at another angle in Arthritis Ireland of trying to develop a database of all people in Ireland with various rheumatoid musculoskeletal conditions. But people won't share what they have, they won't put it in a common pool, and it's a political thing with them. They're very happy to gather our information, well, not that we have any information, but gather from others, but they won't share it. So I think that's where apps will, from that, tend to be very general and can't be a specific application. As I see, it's the biggest problem with Ireland.
Interestingly, to Dragan's point, a lot of the apps that are developed by companies in association with patient organisations have that data gathering motive. That's what it's all about, really. So they're gathering health information that they can then package and sell.
Just the medics are
Part of what I do is actually software development, and I just I want to convey to you that actually it's not difficult to build an app. Depends what you want to do. And if you have a great idea, the best apps were made by one person within 1 hour, what we use today. Most of them, believe it or not. There is a software development kit, both for Android and iOS. And anybody can use it. With a basic knowledge, can build an app. So sometimes I think, and that's how I start my projects, not to think too wildly of what you want, but make something which is going to be geniusly simple and useful, and you can develop it within your organization. And this is what we are going to do now. We are going to try. That's why I'm here at this workshop. What I think I'm going to do, I'm going to employ one guy for our organization who is going to have a timetable, a few months to work with us, and it's not going to be that expensive, and he can later, I think, support the same app. So it's not a big logistical nightmare, even if it looks like that. My experience at least.
I would accept that from the technical point of view, there's no problem. It's the sharing of the human data.
Depends if the app does that. If you need a server or a database that you're going to use or you're going to feed into, depends what the app is for, basically. So that's it. That's the bottom
Could be
line.
very simple and could be very complicated.
Exactly.
Right.
It's going to communicate with other symptoms or other system or not.
But also the information that is on it, is it encrypted? Is it safe?
Yeah.
You know, how safe if you are revealing information about your condition. You know, you don't want it being hacked into, or used and abused.
Or is there another side to it that if you look for a diagnosis bordering on self-diagnosis, is there any liability attaching to the app? Can you sue the app if you get wrong information?
I think
No disclaimer.
Big disclaimers.
So who are you disclaiming? Are you chasing the clouds? You know, there are different levels to it.
if you can sue it or not are probably different in different countries.
Just wondering.
In ours, this more like you quite easy that you get a recommendation to seek healthcare professionals, but also information on why you should seek the healthcare information.
Right.
So why are we asking all these questions? I think that's the two things. So it's more like what kind of questions are, it's more or less the same questions that you will actually get when you're coming to the general practitioner or to your rheumatologist. But you get some information about what kind of question, why is this question, why are they asking about this and that. So, and that's also help you to take the decision to seek or not. It's not a diagnostic. It's not going to say you have rheumatoid arthritis. It's more a decision of whether to seek the doctor or not.
It's information gathering, really.
Yeah, in a nice way, as I think, and also that one question can actually lead to the next question. You find anything interesting from Twitter you want to share with us?
Well, I'm sharing the interesting facts from this table
Okay.
to Twitter because
So
I think
no
that
one-
the audience is listening quite intensely and probably looking for that toolkit that Dragan has.
It's free.
It's for free.
It's for free, yeah.
Well, that's even better.
Where I can see the problem is where the patient-doctor confidentiality comes in, where the doctor says, you know, the patient-doctor relationship is one of confidentiality and privacy and the Hippocratic Oath. So obviously the doctors do not want to share that information, the general public or with support groups like ourselves or others. Patients may share it, but you know, the doctors themselves may not.
No, they're not keen.
So it's difficult to gather the statistics accurately without
You're not
them being on
asking for
board.
specifics, though, Mary. You're asking for kind of like
Yes.
bundles of information, aren't you? Just to give you an overall picture.
Well,
Not asking for
diagnosis of,
specifics.
you know, of rheumatoid arthritis, for
But
example.
I think it's a sad state of affairs for a small island like ours that we don't actually know how many people in Ireland have any of those musculoskeletal problems,
Yes.
how many have RA or osteo or whatever. Everybody estimates. A lot of people, you know, if we gather all the information, the answer is there, but they won't put the whole pieces of the jigsaw together.
You're probably no different than anywhere else.
No, I think it's the
it's the
same
same
anywhere.
everywhere.
Yeah.
We're only
Yeah.
paranoid about it. No, it's no different, but it's an example.
We need your exercise here with only 4.5 million people.
Yeah.
So, what is the current? I see you made some research. You mentioned briefly, but how would you describe the current app market for our?
The app market.
Yeah.
I think the app market is
For this for health apps.
for health.
Yeah.
I think there's a huge app market, absolutely. But it's also more and more that people are actually looking at what is in it, and the credibility, and the owner of it, and so on, and the maintenance, and the security of the e-health or the e-security, the safety. So there's a very large area out there, but it's also we are all different. So I think there's also a market for a different apps, because one that's suitable for me might not be suitable for you, and it's not also, I don't think it will be for everyone, because you have to have the option to choose not to use them.
Yeah.
But nowadays, so I think that's also something to think of.
Even in this health area, say in rheumatology or
Yeah.
in relation to RMDs,
Yeah.
I mean, there's a few obviously apps that are
Yes.
relevant here listed, but you know, and I've come across lots of articles that, you know, they talk about the top 10 health apps, but they're very wide ranging.
Yeah.
They tend to be very general.
Yeah.
I mean, has there been any research done in this area, in our own area, where, you know, for instance, I mean, I know there's the NASS one here from the UK, and I know our own Ankylosing Spondylitis Association here in Ireland developed an app as well. Like, is there any piece of, you know, is there any way we could gather information on what's actually out there at the moment for people living with arthritis or other rheumatic diseases, you know, in terms of...
Sounds like a research project in itself.
Yeah, but I mean, it would be good to know
Well, it'd
what's
be good to
actually
know,
out there.
because then you would learn a little something about how you can make your app stand out in the face of all these other apps.
So you think that's an important task for your organizations to find out the area of all the apps?
I think so, because I
out
think
there?
it's a very new area. Well, I would think it's just such a new area that, but it's only by looking at other apps that you can see what actually, you know, even for instance, I know we've had very positive feedback in Ireland on the one that the Ankylosing Spondylitis Association here developed. You know, for instance, that's available in Ireland and it's obviously in English, but there may well be possibilities if other countries, you know, liked that particular app. There may be, you know, economies of scale here in terms of, you know, where countries have developed something that other countries might want to replicate or replicate part of or whatever. But at least knowing what's actually out there in this area would be really helpful.
Now you're talking about different countries. How should they work? The organizations in between different countries, and concerning if they find good recommendations for this. We have this wonderful app here. What's the organization in between countries? What do you think?
Is there a common site, SITE, that we could go to and say, look, they're all the apps that are in there, make up your own mind? You know, it's a bit like what I was saying earlier about the health care professionals not sharing information. Are we nearly as bad ourselves as national organisations doing our own thing, and that you possibly could end up with countries, as we'd say here, reinventing the wheel, whereas the wheel is already invented. And if you saw the list, you could see, right, we have the wheels, now let's make the bus, you know, move on from there. You know, you say that's a good idea, but maybe we can add on to it and make it a bit better again. So I think if we had a list of what was out there, if that's, you know.
And who should create this list on what is out there? And
Oh, right.
It's
Consumer or
market
organisation, I
research,
think
but
would be very
not
good to
really.
do.
But I have another point of view.
it could be a task for Parek to
I mean, it mightn't be that arduous. I mean, there's a certain amount of information that, you know, people here who are here this weekend have. I mean, you know, if I look at the Irish context, I'll know what's available, and I know, you know, I'll know some of the stuff in the UK and in other countries that I've kind of linked in with, because I can reach out to them and say, what are you doing in this space? So there will be a body of information that could be quite easily collected, I think, initially.
So if Parry created a site that we could send information on to everybody, add it on, we could look at it and see what's happening.
Give more work to Paris.
So you think Parek should create a site?
And yes,
Absolutely.
will
This
post
is
on
ideas from
Brian and Ronnie will post on
I think
our
Florian can manage
We
that.
just going to
just add
collect
something else.
ideas here.
I think everybody that, at least in my world, that does something, they think it should be open to the world, like open to everybody. I think this is some of the basic mistake we might do in developing apps for ourselves. So in the way, I would say better to make something for the closed environment like your membership or something for the time being, and make it like exclusive, that people, you will give a code for them to join. Otherwise, if you just say download the app, they're gonna forget, they're gonna think it's useful, but useless. If you give them incentive, this is important and we want you in the club. So Facebook started out like this. It was a university software, and then it started growing up. So I think it's important, at least from my standpoint of view, to make it in a way exclusive, like you said, for arthritis or for RA patients within the organization, and test it, develop it, and spread it out from there on. Don't go to the app store immediately, which is like to the world. I mean, you'll have to go to the app store anyway, but have it installed via a code or something like that.
So I think this is one, if you should summarize something, that's what we said. We also said in the beginning, there could be an app for where you can send in research suggestions.
Yes.
So that's something we can put on here. That's something that can give back.
Yes.
Participate in research.
Maybe the reverse as well, that you could have an app that would search for you, have search words in it, that would let you off into the research world. You understand me? The reverse of sending in your own material that you can actually look for.
An app that searches for apps?
Something like that. Called a circle. Going around the circle.
So this new app could be like a bank for researchers. Both for going there and see what's really, we need to see what the patient organizations really want us to focus on, and also if you are a patient, what's out there, what's actually
two-way traffic.
Yeah, two-way traffic. Yeah. And then we also wanted to have a rheumatologist online.
Well, absolutely.
Yeah.
Yes. Or
Be better with 24 hours.
Good to check whether these ideas have not been implemented already.
That's your part task to do that.
Sorry, are there any countries within Para?
No, we have like 5 minutes left, so I'm standing here to just helping us to summarize.
Are there any countries who actually do that?
Yes, yeah, I know. But still we can have it as our suggestions.
I think as a patient, and I also work as a healthcare professional in a large hospital here in Dublin, I think there's always a huge communication problem, even within the hospital itself, between different departments. I work in the laboratory. We have a completely different system to the radiology department, the wards. We all have different software packages, and they're not. I get, 10 calls every day saying I can't see results. I'm on wards, whatever. So there's kind of practical issues there, and like as you were saying about appointments. So like for me, appointments, blood tests, and prescriptions are my main maintenance, I suppose. If we were to have like an interactive between the healthcare system and the patient, so the EID is a very, very good idea.
Very important. But do you think that's a task for the patient organizations?
Yeah, I know within my laboratory the government are hopefully rolling out a national laboratory information system. Thereby, it doesn't matter where you are in Ireland, you can link in. But it's for the healthcare professionals.
And access results.
Yeah.
That's great.
Locally, you can, the GPs, the general practitioners, can link into the hospitals. They have security codes and all that. But it would be great to have it from the other side, from the patient side as well. I don't know, like it might not be an app as such, as opposed to log into a website and kind of
That's something that you as a patient can log into your results wherever you are.
Yeah. So it's just linking up all these
databases.
Yeah. There's too many databases and they're not talking to each other.
We also talked about the organization as the one who should be driving the credibility and the needs of the apps. That's an important task. What kind of apps the patients need. So
you have to ask the patients that.
But the organization should be
credible to begin with.
Yeah.
Well, I can think of a case where there's an app that explains the model of care or the care journey in your particular country, which is something that patients should know if they're going to be part of the team in their own healthcare, and yet they don't. That information is not readily disseminated by the healthcare system and
so
by
like
patient
a
organisations.
process map kind of.
Exactly,
Are you saying you know that already existing, or you think it's a good idea?
I don't know that it exists.
Oh, yeah.
So it would be something that's...
You're very interested in that.
There is a system set up in Tallow under Professor Kane. He has
the long-term care plan for a disease.
The nurse, the specialist nurse, she has a whole scoring system that she gets her patient to log on. Do you remember what it's called? The special scoring system they have. And the patient in her visit with the nurse, or his or her, will actually go online. There's a program they use, and you put in how many swollen joints you have had, with your blood tests, and accumulatively they have a score, depending on that.
I see.
Yeah. So whether you need to go to a physiotherapist or whether you need to go to your occupational therapist or whatever.
That's excellent.
Yeah.
May I just add a couple of words to your last point there, because by giving the driving the credibility of those apps, I think the organizations, what has been mentioned, should act as advisors, as consultants, in order to advise anybody who wants to develop a health app, and really be proactive in that, to show that you are, as a national organization or disease-specific organization, the source of to be contacted in order to advise on the patient's needs. If not developed already by themselves.
It's a little bit of the same thing here, the same theme actually, I think. We want Harry to help us to collect what's out there. But then and the local organizations more a source to where you can go for credibility and consultants when you want to if you want to develop an app, and what are the needs for the patient organization or the patient out there. So,
of course, I mean, in Ireland it would be Arthritis Ireland on the subject, or on a disease, on a specific disease, it would be a disease-specific organization that maybe act as the consultant or position themselves.
Yeah.
Power can act as that.
No, but more, it's more that we are talking like a suggestion for something. Where should we collect all the good examples?
Just a list of what is out there.
What is out there, and then there will be another step if you should translate or communicate or collaborate and so on. That's the next step. But first of all, we want to know good example of what's out there that PARA could recommend. Isn't that what you said from the first? As one recommendation from our workshop here.
So basically EULAR.
But I think if it's apps that's being used by the patients and the patient organization, PARA should be involved. Isn't that what you said?
Most definitely.
Yeah. I think we soon are going to summarize. Is there any other recommendation you want to give to the organizations to work with? More important subjects.
Get those done now, we'll be very happy.
But we have some visions and we have to give them some ideas, I think. It's not that we know this.
I know.
Yeah. But we have to start with ideas and vision, otherwise we'll just stay where we are. I think. So I'm just going to consult Loreto, so you can continue the discussion.
Can you get it on?
So we're going to have EULAR recommendations on apps.
It's not that bad actually, because there are workshops about recommendation in the European Committee, how to assess guidelines on eHealth.
Yeah.
So it's, you're not
too
far
far
away.
away.
That's not far away from that.
As long as it's in lay terms, right?
Yeah.
See the juice. It's not your fault, Brian. It's your start.
I mean, I had an interesting discussion with a friend of mine, and he said, well, soon we will have the fridge telling us what is missing in the fridge. And then
That's already
and
done.
then, but then tells us that it's actually too fatty, we're not allowed to eat.
That's not there.
I don't want that app.
Yeah, you've removed enough calories from the fridge today, you're not getting anything more. And that is, that's a smart thing.
Can somebody help me with this? So, can we have the leaders of the groups? You want to start? You want me to hold this?
So I just wait for the last group over there to be seated. We're still very busy down there discussing. So I think I have to start then to summarize a little bit what we're talking about in our group. First of all, we wanted to give a suggestion to PARE to collect some places where we can actually collect all what's out there. So we gave the suggestions to PARE to be a place where to collect good examples.
So like a repository of apps or?
Yeah, didn't want to invent the wheel, so we wanted to know where could we find good examples. And then there will be another step to how to collaborate and translate and all that. But we want to know what's out there in all of Europe. And there was a suggestion for a new app that we didn't know if it existed. An app where you can actually send in research suggestions. What should the researchers, the scientific world, focus on? But we also wanted a simple way to also search for research. So for the patients to find what research are there out there. Of course, in our group, we would very much like to have a rheumatologist online. We think it's important, we discussed the importance for the local organizations to be looking after the credibility and the drivers of the needs and kind of advisors for people who want to develop apps. So kind of a consultant, so they can actually go to the patient organization and ask, is there a need for this? But also be proactive and kind of a source. And then in the end, we actually talked about, should there be EULAR recommendations on health apps?
Very interesting, very interesting. That was a very spontaneous or... Yeah, very good. You want to come up here or you want... Let's see if you can get through here.
So we had a very lively discussion in our group, and
Yes, indeed.
the biggest challenges that we all say that we face if we decide to develop an app is the cost, the money. So everybody was considered to develop app, but everybody says that unfortunately in many countries they don't have the resources to do that. But there are also some other obstacles, challenges that we face in the process to develop an app, which is of course is the language. And the language should be also, to say, the solutions. For the language, we have said that it's very important to have this very simple language, lay language, for the people to understanding. But also, in order to reduce the cost, this is also a solution for the cost, but also relevant to the language, is that we can have apps collaborating with countries they have the same language. For example, the German-speaking countries, they can collaborate together and to develop one app, not 3 different apps with the same topics. So for the cost, we have said, of course, we need sponsorship, and the suggestions from my group is that we can ask and send proposals to the EU or to the Norway funds, but also we can ask the industry, the pharmaceutical industry, is the pharmaceutical that interested to sponsor this. But also there is a suggestion that we can charge the users of when they use the app. So we can selling the app to the users, but not to the members.
Very expensive, but not very expensive.
Not very expensive, just to have some money back, but not for the members. So could be this serve as an incentive for people to be members of the organization, and for the non-members they have to pay in order to benefit from the app. Another challenge is that the different platforms that we should design the app in order to be accessible from other platforms, Apple, Androids, and other devices. And it's very important to ask the patients what is their need, because we have to develop the app tailored to the needs of the users, of the patients. So we have to ask them what is their needs, what do they like to have as an app. But also it's nice at national level to collect data, but also to have a research at national level about different apps in the health area, not in order not to duplicate things, but also not to invent the wheel. So if there are already some app. Also, we have identified as a challenge the people that they are fear to use the technology, especially the people after 15, 16 years old. So we have to educate them. And also there is a suggestion that we can have a helpline for apps in order to support them to use the application. So of course, from the beginning, if we have the money and if we know what we going to develop, and then we should have a steering group who should decide about all these things. In the steering group, we should have patients, clinicians, health professionals, but also we should see the legal issues, the national regulations, legislation. So we should maybe have a lawyer to advise us for this. What else? In the other? So, and of course, if we have the app, we should test it. We should have a test group in order to evaluate the app and that everything is okay, that we have solved all the problems before we give it outside. The time is one also very important challenge. And it seems that it takes a long time and a lot of resources to develop an app. The last one, of course, I said also in the beginning that for many countries it's not a priority. So in many countries, especially in the south of Europe, they have other priorities than to develop now, and they don't have the resources to develop an app. Yes, that's all.
That's it.
So I would like to ask my group if something that I forgot to mention, if somebody wants to add something. Okay. Thank you.
Thank you. You want to sit in here?
Okay.
So finally, I think all the ideas that came out don't reflect that this is siesta time. All the opposite, even, or you are dreaming. In my group, we talk about the importance of having an idea before having the money. Although money was the first challenge that came out, actually we talk a lot about building the idea, building a business plan before going, and having a budget before going out to seek for money. So in the idea stage of the development, we said some things that were very important. One is that it needed to be something that it would be useful for the final users. So it needs a clear objective. We talk about the complexity and the need to negotiate. Everybody wants something in the app. So you have to come to a clear objective, a clear frame of the app that you're looking for. Then, very important, the target, who is the population that is going to use the app. Very important to define upfront the ownership of the app, and that it has to be very user-friendly, otherwise it will not be used at the end and it will be a failure. All the ethics issues need to be taken care of upfront. Very important to do some research before developing any app, because we might come to a place where we reinvent the wheel. This is something that has come out in other groups. We should not reinvent it. So we should do some research, and also to do focus groups with the final users to see what are the needs, the actual needs, some surveys, and also to include in the business plan a measure of success. For instance, it could be whether the app has been used or not, and to measure the success regularly. It's important that the app is controlled by the users and not controlled by either a hospital or controlled by a pharma company or any other thing, but the user decides where the information goes to, so there are choices. Okay? At front, it has to be decided what all the connections of the data will be, like either the data is going to be connected to networks or the data is going to be connected to doctors' offices or whatever. And also important to have deadlines. We will have to finish by here, or we will have to do this part by here, or we will check whether it's been useful or not by here. Okay? And in our group, contrary to Mario's group, we saw that it was important to get it for free, but although the idea that you said that non-members should pay, it's not that bad. And then, when it comes to the second part, that is finance, we have some very good ideas from the UK, which is if we develop the app as if it were a research project, we can get grants in the different stage of development, and that will not only get you the money, but also get some support from research groups. We could also get some money from the drug companies, and many other agencies or other companies, not necessarily drug companies, and also philanthropists. And when we go for the money, we need to write contracts with the funders or the sponsors to make sure that the owner are the associations, and also to find something to give them in return. So you have to say upfront in the contract what they will get in return. And very important to do everything, it's very important to have the involvement of the users from the beginning, and also the collaboration with all sorts of the stakeholders. And there's one kind of collaboration that I thought it was very interesting, which is technical volunteers. This means that since the beginning, we involve, let's say, students or people who are juniors in the informatic field, and they are there in the development so that they volunteer for the association to do the maintenance. That's a way keep the app going on time. So this is it. What, did I leave anything? No, more or less. Okay, so this is the feedback from the groups. What do you want to comment, or what do you find interesting? Do you want to develop an app now when you go across the door? Yeah, there's a question there. Or you just wanted to stretch? I've heard a few comments about repositories of things like a list of apps or something for parents. What does the vice president think about this?
Excuse me, okay.
About having a repository of apps
yes,
or
yes.
health services?
Of course, this will be very helpful, I think, but of course we should discuss in EULAR because we should validate the apps. We cannot have the stamp of EULAR, as you know, in a product that we cannot evaluate first and validate it first. So yes, this is something good, but also this is something that could be the network of the part organizations do by themselves, so they can communicate with each other and they can collaborate in this issue. And as I said also in my group, that we can make regional collaborations and to develop apps. But I'm very much interested to see about the sponsorship issues, because it seems that the money is the biggest challenges, because I ask all the people in my table if they have the money, and then they are proceed with developing apps. Everybody said yes, the money. The money is the big issue. So I think if we give some practical ideas, and what you said about UK is it's a very practical idea, yes. But I would like to ask you, what do you think about sponsorship from the industry? So is this something that you can think about, or you think that it's not good to the industry to sponsor the development of an application?
Are you comfortable if a pharmaceutical company designs an app and gives it to your organization? There.
Well, I wouldn't be comfortable with the pharmaceutical industry giving an app. I would welcome the pharmaceutical industry in working together with us in financing under very strict conditions, transparency, not being allowed to participate in the development of the app. But as I have explained at the table, what we give the pharmaceutical industry, just as any other sponsor, is that they are seen as partners, and they can put up something on our website, etc. Oh, and in that way, we see that they want to support us, and that is not a problem. But for us, it is very important. There are contracts we use, that there's transparency, that they have no say in anything, and that the information involving patients is always kept with the patient organization. They have no say, nothing in it. But of course, if they want to help us, why not? The government is receding. We don't get that much anymore of the government. We have to have our monies, get our money somewhere. So that might be another discussion, but that's the problem.
How many of you do you, national level, your organizations, they have a magazine? Who is sponsor the magazine? Drug companies.
Drug companies, and sometimes also personal.
Various companies, because we have discounts for our members. So we have discounts for the members of our organization, and all of those, like I would say, chip in. They give a little bit. But it's not that expensive. We save some money, and the magazine is like maybe €1,000 a year. So we don't have to beg for anybody or ask for.
So the cost is not too much.
It's not too much. It doesn't cost too much.
So who is considered to develop an app after this workshop?
One app.
Please. Dragan? Yeah. Only?
There's another. But that app was already pre-planned. What about yours?
Actually, we had a really interesting conversation with Marek in Estonia about the app thing and everything. But we just need funding. We have ideas, but we need funding. And when we don't have the money, then we should do something else, not just waste time, just rolling around with those ideas.
Have any of you considered crowdfunding? You don't have crowdfunding platforms in your country?
Yes, we do, but to be honest, it's rheumatism, and I think our association is not that kind of sexy thing that people want to give money for. That they want to have entertainment, and when we don't give them entertainment, they're like, why should I put my money into this?
But I would say if you ask me €20 to develop an app, I will probably give €20 to develop an app if it's related to health, and you sell it to me nice. I mean, even if it has the word rheumatism, which is not sexy, but you could have health in it, which is sexy.
When considering Estonia and different people over there, then even like €2 to €3 is like, okay, I may have a little beer or a candy or something, but I don't know. Asking money in Estonia is a bit taboo thing. We're not in this stage yet.
Interesting.
Okay. I would like to ask you, because Loreto said what the PARE can do in order to support you in this process. So what do you think that EULAR and the Standing Committee of PARE can support you on this?
Funding.
Except of funding.
Well, the helpline was a good idea, I would say. I mean, to have somebody you can contact when you have a problem with an app, or you want some help in designing it or something.
Expertise,
yeah,
share expertise.
Some expertise, yeah.
As you said, maybe share best practice.
Yes.
Anything else that maybe you need from the Standing Committee of PARE?
Coffee break?
You finished?
No, I mean, if there are no more issues, we can just rest for 10 minutes. It's not bad, or stretch, or find an app, or download something. Okay, so I think we're finished. Thank you very much for contributing to this very enlightening session, and that's it. Thank you very much.
And I think the coffee will be served down there in a few minutes, and I suppose you're going to be back here past.